Cranberry fruit 400 mg tablet is commonly used for reducing the risk of bladder infections, also known as urinary tract infections. It may also help in decreasing the smell of urine for people who struggle with incontinence. However, it's important to note that this product should not be used as the sole treatment for bladder infections, as it may not be effective and could potentially worsen the infection. It's always best to consult with your doctor or pharmacist before starting any new medication or supplement. As for the daily dosage, it's important to follow the recommended guidelines provided on the product packaging or by your healthcare provider. It's generally best to take cranberry fruit tablets at the same time each day to maintain consistent levels in the body. When taking cranberry fruit 400 mg tablet, it's important to follow the directions on the product packaging. If you're taking the chewable form, be sure to chew thoroughly before swallowing. If your condition persists or worsens, be sure to inform your doctor. Additionally, let your doctor know if you experience any symptoms of a urinary tract or bladder infection, such as fever or painful urination. In some cases, you may require medication like antibiotics to treat the infection. If you suspect a serious medical issue, seek immediate medical attention. If you experience stomach upset or diarrhea with very large doses of cranberry fruit 400 mg tablet, it is important to contact your doctor or pharmacist. Additionally, if you notice any serious side effects such as severe stomach or abdominal pain, it is crucial to seek medical attention right away. While a serious allergic reaction to this product is rare, it is important to seek immediate medical help if you experience symptoms such as rash, itching or swelling, especially of the face, tongue or throat, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects. If you notice any other effects not listed, it is important to contact your doctor or pharmacist. Before taking cranberry fruit 400 mg tablet, it's important to consult with your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have a history of kidney stones, it's essential to talk to your doctor or pharmacist before using this product. Liquid products and chewable forms of cranberry fruit 400 mg tablet may contain sugar and alcohol. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, it's important to ask your doctor or pharmacist about using this product safely. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this product should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is unknown if this product passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. When taking cranberry fruit 400 mg tablet, it's crucial to follow the recommended dosage and take it at the optimal timing according to your healthcare provider's advice. When taking cranberry fruit 400 mg tablet, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of cranberry fruit 400 mg tablet. As always, consult with your healthcare provider for personalized recommendations. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Make sure to keep all your scheduled medical and lab appointments. This will ensure that you are properly monitored and receiving the best care possible. It's important that you follow up with your healthcare provider to make sure the medication is working effectively for you. If you forget to take a dose of cranberry fruit 400 mg tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Please refer to the storage information printed on the package of cranberry fruit 400 mg tablet. If you have any questions about storage, ask your pharmacist. It is important to keep all medications and herbal products away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. It is important to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.